Good morning, everyone, and thank you for joining us today for our Lunch and Learn with the Task Force on Eliminating Subminimum Wages. My name is Maddie Wagner. I use she, her pronouns, and I work for the Olmstead Implementation Office. For a brief visual description, I'm a young white woman. I have clear glasses. I'm wearing a pink shirt, and I'm working from my home. So before we get started today with the presentation, we just want to go over a few ground rules. So during today, please stay present and be respectful of other participants. Please do not share your personal contact information in the chat or while speaking. We want to make sure that your personal information is safe. And please stay on mute throughout the meeting unless you are speaking. This just helps minimize noise so everyone's able to hear our participants. This event is being recorded and the recording will be shared after next week. And at the end of today, there will be time for questions. You can submit those to the chat to one of the presenters. Next slide, please. We do have accommodations today. Cart captioning is available if you'd like to access those. You can click the CC closed caption button at the bottom of your screen to see the captions. We also have some ASL interpreters. You can pin their video to your screen so that you're always able to see them. If you're wondering how to pin them, you can hover over their screen and click the three dots that appear. Recording and materials will be available after the event. They will be emailed out to all participants, but will also be available on the OIO website. So with that, I'm very excited to hand it over to some members of the task force for eliminating subminimum wages. Next slide, please. Thank you.
All right. Well, welcome everybody. It's so nice to see so many people here today. My name is Andrea Zuber. I use she, her pronouns, and I am the CEO for the ARC Minnesota. And I also had the honor of co-chairing the task force on eliminating subminimum wages. I am a white woman with long blonde hair and blue eyes. I have a floral shirt on and I am sitting in my living room. One of the things that I wanted to just briefly touch on, we're going to get into introducing all of our panel members in a couple of slides. Just wanted to briefly introduce myself. I probably know several of you that I can't see right now out there in Zoom land, but I have been working in the disability services field for 25 years. I grew up in this work because both of my parents were heavily involved in the deinstitutionalization movement in the 60s, 70s, 80s, and 90s. They started working with the ARC Minnesota back when they were working to close our state hospitals and state institutions and spent the bulk of their career on that work. And then when I got into the field, I started out as a practitioner and a direct support professional. Spent a lot of time working in different day training and habilitation, day programs, supported employment, and group homes across the state of Minnesota. I've had the honor and the privilege to work with hundreds of people with intellectual and developmental disabilities and really get to know the spectrum of unique needs that are out there. And I'm super excited to be here today to present this work with you. We've obviously come so far over the last 5 decades since my parents started working on this movement to make sure that we have belonging and justice and equity for people with disabilities. And this is, kind of a continued phase of that. So it's exciting work that you're going to hear about today. Next slide, please. So what we're going to work on today is we are going to introduce the task force on eliminating subminimum wages and its work. We're going to tell you what our charge was, about the plan that we came up with, and how we came up with that plan. We will outline the recommendations that ultimately formed the basis of a report that was submitted to the legislature in February of this year. We will discuss the current proposed legislation that's in the governor's budget. to phase out subminimum wage by 2028. And then we will address frequently asked questions that folks have. We have compiled a whole grouping of answers to all of the questions that we've been hearing. We've been presenting this to a lot of different groups across the state of Minnesota, and are definitely have heard different or similar themes of questions. And so we have a lot of those outlined for you today as well. So I will now turn it over to my task force co-chair, Jillian Nelson.
Good morning, everyone. I'm Jillian Nelson. I'm the Community Resource and Policy Advocate for the Autism Society of Minnesota. I'm also an autistic adult. I was appointed to the task force by the State Rehabilitation Council. And fun fact, my grandfather worked alongside Andrea's parents closing the institutions, and now we get to do this work together. I just want to give you some background about the task force on eliminating subminimum wage. This is a movement that started in Minnesota about 4 years ago. It was actually led initially by 4 self-advocates, including myself, that really started this conversation. But what we knew from the very, very beginning was that we couldn't have a conversation about ending subminimum wage unless we had a plan. We couldn't just go in and say, okay, it's time to end this use. Like we knew we needed a plan. And that was how the task force was born. More people in Minnesota earn subminimum wage than in any other state in the country. That is why we knew we needed a plan. We weren't looking at a tiny fraction of people. We were looking at a significant number of people. Although I will say that that number has dropped by more than half since this started 4 years ago. We knew, though, that everyone in Minnesota deserves the best outcome and the most stable supports and services possible, and that's why we want to put together a plan. The task force has completed its plan. It took about 12 months, but here we are, and we've been widely sharing our plan and the recommendations. There is currently legislation moving through our legislature.
Here we go.
Looks at implementing some of those recommendations.
Thank you.
We've seen adoption of those recommendations from the governor's budget within the DHS recommendations for the year, as well as legislation brought forward by the Minnesota Coalition for Disability Wage Justice. So there is definitely momentum towards taking these recommendations into law. Next slide, please. It's my honor to introduce the task force members that you will hear from today. This is by far not all of our task force, but these are some individuals that are going to be sharing some stuff about that plan. First, myself, Jillian Nelson, task force co-chair. I did forget my visual description earlier. I am a white woman with teal hair, wearing a black sweater and a teal blouse, sitting in my office. Andrea Zuber, my task force co-chair, who you've already heard from. We will also be joined by John Alexander, who we fondly call Alex. He is a task force member representing an employer who has successfully transitioned away from payment of subminimum wage to people with disabilities. We will also be joined by Alex Young, a task force member who is a person with a disability who is neurodiverse. And then Heidi Mahan, who is a task force member representing an employer authorized to pay subminimum wage. And I would like to invite Alex to come forward and give us some information about the task force specifically.
Introducing the task force. I am going to talk about the work of our task force and who is on it. The Minnesota legislature told the task force to create a plan and make adjustments to the phase-out payment of subminimum wages to people with disabilities by August 1st, 2025. We did that and gave our report to the legislature by February 15th, like they asked us to. For our plan and recommendation, the task force was asked to do a number of things. Understand the benefits of ending subminimum wages, find solutions to challenges, engage and educate people, describe what support and funding would be needed to phase out subminimum wages, find ways to increase employment for people with disabilities, come up with ideas to track progress towards ending subminimum wages. The legislature told the task force to plan for an end of subminimum wages. The task force did not take a position on whether subminimum wages should be eliminated, unless instead we recommended what we needed to in order to end them, like the legislator asked us to. The task force is not able to end subminimum wages. The legislator has to act in order to do that. This task force was also told to consult with the Commissioner of Human Services and advise her on statewide policy for eliminating subminimum wages and waivers for home and community-based services under the Medical Assistance Program. There are 16 of us on the task force for eliminating the subminimum wages. Our task force includes people with disabilities, people from groups that advocate with and for people with disabilities, people from state government, people from groups that provide services to people with disabilities, and the task force includes a parent of a person with disabilities. If you want to know who is on the task force, you can see the list on the task force website. Search for the words Minnesota Task Force on Eliminating Subminimum Wages, and then click on the tab for members.
And I'm up next. My name's John Alexander. I am a white male with a blue shirt and cheap dollar store reading glasses. I am going to share with you about what the task force did to create reports and recommendations. The task force met for the first time more than a year ago in February of 2022. From the time of that first meeting until earlier this year, task force members and others carried out a range of work to come up with our plan and recommendations. I'm going to talk about what we did to create the report and recommendations. Staff from state agencies here in Minnesota conducted interviews and research on 4 model states: Maryland, Oregon, Iowa, and Ohio. We looked at these states because they had successful outcomes for ending subminimum wages or because they were similar to Minnesota. People in all 4 of those states mentioned the importance of certain steps that Minnesota has in place, like transition resources and planning, and they spoke positively about the shift to minimum wages. We found Minnesota already had in place many of the things those states recommended, such as dedicated employment services, interagency collaboration, day services, and robust funding for services. And some we need to work on, like data collection and information campaigns. Go to the next slide, thank you. From that research into other states, we produced some task force background briefs. You'll see the list here. They included benefits and challenges to eliminating subminimum wages, state policies that help the transition, services to support people to move to individualized employment, transition support for providers, and funding and financial support for transition. And now I think I'm throwing it back to Alex J.
The task force worked with a group called Public Sector Consultants to engage with people about work and subminimum wages. How did public sector consultants engage with people? They use interviews, small group discussions, larger listening sessions, a survey, and sessions about the solutions the task force was thinking about. Who did we engage with? As the slide says, we engage with people with disabilities, families and trusted supporters of people with disabilities, people from state and federal government agencies, advocacy organizations, organizations that provide services, including those that use subminimum wages and those that used to but don't anymore, and case managers with county governments. From that engagement with people, we heard the same sort of themes across all walks of life. This slide and the next slide list out some of those common themes. I won't read through the ones on this slide, but I'll mention a couple of themes. We need a cultural change around work by people with disabilities. Many still believe that people with disabilities can't do paid work or can only work in limited roles. There are worries about benefits. So benefits are still a barrier to ending subminimum wages. People need to know how to have conversations about benefits. They shouldn't let worries about benefits stop conversations about work and pay. And people still need help understanding how to create a schedule that blends day support and work together. Maybe even work at multiple jobs. Here are some more engagement themes on this slide. They are about transitions to employment, coordination, training for case managers, and direct support as workforce strategies. The task force used all of the feedback from our engagement activities to help us develop our recommendations to the legislature. The task force tied recommendations directly to all this feedback and themes. Each engagement theme matches up to a recommendation in the task force to report to the legislature. Okay. The task force has used 4 work groups to come up with ideas for our plan and recommendation. We came up with work groups based on what the legislator asked us to do and based on all the research and input. The 4 gray boxes on this slide show our 4 work groups. The 4 work groups developed swift draft recommendations that the task force review talked about, reacted to, and changed in some cases. Task force members voted on final versions of the recommendations. All but 2 of the recommendations got approval from the task force members. So the approval from that was unanimous. For one of the other recommendations, everyone but 1 task force member voted to approve. And for the other recommendation, everyone but 2 of the task force members voted to approve.
I got it. Thanks, Alex. The task force report has 2 sets of recommendations. One set is for the transition plan and includes what the task force agreed is necessary to eliminate subminimum wage. And one set is for other recommendations that address existing barriers and improve our systems, so they go beyond the transition and what's required to end subminimum wages. Next slide. Here are the 5 task force recommendations for the transition. So recommendations that must be in place when subminimum wages end in Minnesota. And I'll let you read those. These correspond to themes from input and feedback at our engagement activities. Change can be hard. There's a need for assistance and targeted efforts in the state. Families and people concerned about what will happen during transition and want to make sure we have good information and assistance available. From the task force work, we lack reliable data on subminimum wages, and we want to be able to track outcomes during transition. And next, my good friend Heidi Mahan.
Thanks, Alex. Next slide, please. Hi, my name is Heidi Mahan, and I'm a white female with gray-brown hair, hazel eyes. I've got cheaters on, and I have a pastel striped shirt and a gray vest, and I'm wearing a black headset with a boom mic, and I'm at the library today. I'm sharing with you the recommendations to address barriers and improve systems. In addition to the 5 recommendations that John Alexander just talked about, there are another 15 that the task force presented to the legislature. These are the recommendations that addressed existing barriers to improve our systems, so outside of the transition and what's required to end subminimum wages. We grouped these other recommendations by topic. So here the topic is to improve information and education about available supports. We want to strengthen information on services and supports for people with disabilities in school and using waiver services. We recommend embedding work and benefits information in support programs for better understanding of benefits and work. We recommend to build benefits planning competencies for support professionals, prioritizing benefits planning. These correspond to several input and feedback themes about communicating better about available services. People aren't aware of supports like customized employment or employment services. Another theme here is that benefits concerns are a reason people and families did not pursue employment. We also want to invest in professionals' capacity to support employment outcomes. These recommendations match the engagement theme about direct support as workforce strategies. To increase training opportunities and requirements, include leaders and managers and providers. Next slide. We continue on with 5 recommendations that also match themes for the input and feedback gathered during our engagement activities, specifically to plan for meaningful day support services for those who do not move into community jobs. Ensure equitable access to services, training for case managers to support transitions to competitive employment, consider direct support as workforce strategies, and make sure public transportation is available, reliable, and accessible. In addition, these recommendations correspond to input and feedback about community businesses being important partners in the transition, and the need to raise the expectations of people with disabilities, the need to promote their strengths and capacity. We recommend conducting a coordinated employer communication and engagement strategy and develop an inclusive worksite training and certification for Minnesota businesses. For these 3, the matching engagement themes are to improve consistency in transition from school to competitive employment, and to improve coordination between vocational rehab services and waiver case managers, ensuring that work experiences self-advocacy and seamless referrals between school professionals and vocational rehabilitation. And I'm going to toss it back to John.
Thanks, Heidi. The legislature has taken up the issue of subminimum wages this session, partly because of our report, perhaps partly because of our report, and maybe partly because of increased interest in ending the practice here in Minnesota. Let me offer an update on the current status and support for legislation. And I'll say that this was from a week or so ago, so if I'll try to adjust as best I can. House File 2513 in the House and the companion Senate Bill, Senate File 2669. Bills introduced the state legislature bills introduced into the state legislature that also end the use of subminimum wages in the state of Minnesota. The governor's budget includes recommendations aligned to the task force report, and it's included in the Minnesota House of Representatives Health and Human Services Omnibus. The task force and legislative action to end subminimum wages has drawn attention and support. The purpose of there's a coalition for disability wage justice. The purpose of the coalition is to support legislation to implement the recommendations of the task force. The coalition includes many members from advocacy organizations, providers, training and technical assistance entities, unions, counties, cities, and others. There was testimony in 3 House hearings and 1 Senate hearing. In addition, there's been media coverage on Minnesota Public Radio, the Star Tribune, local news, Disability Scoop, and national outlets. The governor's budget includes proposals aligned to the report and the consultation of the task force on eliminating subminimum wages provided to DHS. The governor's budget prioritizes changes to Minnesota HCBS waiver services and the recommendations most directly connected to successfully implementing those changes. This is included in the House Omnibus budget bill. It is not included in the Senate budget bill. Differences between the Omnibus budget bill from the Minnesota House and the Minnesota Senate will be settled through negotiations in a conference committee later this session. The governor's budget includes technical assistance for providers, grants for lead agencies, a data collection system, engagement and communication campaign, strengthening core information on supports and services, study of interagency program alignment, inclusive workplace training and certification program, and addressing case management with their training requirements. And I'll hand it back to our co-chairs, Andrea and Jillian.
All right, thanks, Alex. This is Andrea Zuber again, co-chair for the Task Force on Eliminating Subminimum Wages and CEO for the ARC Minnesota. So I am going to start us off with some discussion about some of the questions that we have been hearing as we have been traveling around the state and presenting this information to many different groups of people. So one of the primary things that we hear questions about is this number one bullet on this slide, which is that centers and day programs can stay open. If subminimum wage were to be eliminated, they can and will stay open. Many providers in Minnesota have voluntarily and successfully transitioned away from using subminimum wages and are open, viable, thriving providers serving people at the same level that they were before. We know that experience has shown that most employers are willing to renegotiate to pay minimum wage through those contracts that they have. So it's important to understand that there are different parts of the budgets that providers use when they're putting their budgets together. One part focuses on services and supports. And those are the daily per diems that the providers receive to pay for the services and supports for people attending the day programs and work sites. It pays for the staffing, it pays for the overhead, it pays for the general operations, it pays for the infrastructure needed, it pays for transportation. So none of that is changing. All of that stays exactly the same. So providers can stay open and provide the same level of services and supports as they do now. The other part of their budget is that some providers voluntarily choose to contract with local employers to bring in contract business, and then they pass the wages along to people with disabilities. That's the part of the budget that would need to be renegotiated with local businesses. Providers don't have to increase wages to pay people more. It's the local businesses that would need to do that. And what we've seen is that the majority of businesses are willing to renegotiate contracts so that people can be paid minimum wages or higher. We had one provider who is on the task force. They had 18 contracts with 18 employers. When they phased out their subminimum wage certificate, 17 of them renegotiated their wages so that people could continue to work there and get paid the minimum wage. So again, this is solely about wages, not about services. And in fact, there will be additional money for providers if the proposal that's in the governor's budget and the House of Representatives omnibus were to pass this session. There will be additional money for providers to transition their business models. So it would provide them support with figuring out, all right, we still have all the same money for services and supports. How do we work with those local businesses and renegotiate those contracts? So, and then finally, we know that where there is a will, there is a way, and that when there has been leadership at provider organizations who have voluntarily decided to phase out their 14C certificate, it has gone well and successfully, and they've been able to do that.
So customized employment supports people with significant disabilities to be successful in employment. We believe that the right job is out there. We just need to be creative and hardworking to find it. There are services right now that can help people plan, find, and keep a job that matches their skills and interests. The task force recommendations include ones about information sharing, about benefits and work education throughout support programs, about building the benefit planning competencies to support professionals, and about engaging with people who currently earn subminimum wage to help with benefit planning during the transition. Managing work and benefits takes planning as well as understanding the work incentives that exist. Through its engagement work, the task force learned that people and families are not aware of incentives and are concerned about benefits. Programs like medical assistance for employed people with disabilities, or MAEPD, allows people to keep waiver services while working. Greater Minnesota has also had success with these transitions. There is a high demand for workers across the economy, and this is a great opportunity to get people into jobs. As far as Greater Minnesota, ending subminimum wage hasn't been tried as much, but when it has been, it's been Lake County with the highest rate of employment per person with a disability per capita, because they've directed those funds into customized employment. Technical assistance will help these providers immensely. Personal note, I actually believe Greater Minnesota is going to thrive in this just because of that small town community and culture that we absolutely love about Minnesota and Greater Minnesota. We have the labor market right now where there is a historically high demand for workers across the economy. And this is a great opportunity for us to get people into those jobs. And in some cases, to structure what existing jobs look like to create customized employment to assist everyone better. Andrea, do you want to take the next one?
Yep. Thanks, Jillian. So the next slide is just kind of a way to make sure that we're reiterating what we really know are kind of the questions in people's hearts and minds. We've heard from a lot of families that they're worried that their children are going to have to stay home and that they're not going to have anywhere to go and that their day program is going to close, and that we have seen that that's simply not the case. Again, day programs can stay open. All current funding for services and supports stays. Day programs will remain fully funded. People with higher support needs can continue to get the same level of care that they do now. A shift to more people moving into customized community-based employment can actually help balance the direct support workforce issues, as some people who have lower support needs are able to move out and into jobs where they are more supported by their employer during the day and have those natural supports in place. That frees up staff who are currently working and can work with people who have those more significant support needs. So this really could balance that out in a very nice way. And in fact, there will be more choices available for people. We know that from some research the Minnesota Disability Law Center did, that 80% of day programs in Minnesota offer one type of subminimum wage work. And so this actually would be a way to make sure that there are more choices available for people in terms of their work and how they spend their day. So that is the slides that we had available, or that we had put together for this presentation. And now what we wanted to do was, instead of having people turn on their mic and ask questions, we actually asked for questions to be submitted before the presentation. And so we did create sort of got a lot of questions that were similar. So we kind of grouped them together. So we might not be reading like the exact question that you asked, but we kind of, put them into themes because there was a few that were pretty similar. So I'm going to answer a couple of those questions, and then Jillian is going to answer a couple of those questions. So the first question is, how will people who are unable to work or have high support needs and significant disabilities be supported in community employment? So one of the things that that we wanted to make sure that we call out here is that Minnesota is an employment first state. And that means that we have the expectation that people with disabilities can work in customized, integrated, community-based employment, and that we have a robust array of public supports that can help people meet their employment goals regardless of their disability status. Jillian talked about how the state of Minnesota believes that the right job is out there, and we just have to be creative and work hard at finding it. It's really important to remember that when we talk about customized, individualized employment and people having a chance to explore that, people who have typically earned subminimum wages, it doesn't mean that people would be moving into 40 hours of work per week, even 20, right? It could just be a couple of hours. It doesn't mean that they would work independently. They would work with or without supports, depending on their goals and their support needs. And there are services right now that we have available in Minnesota that can help people plan and find and keep a job that matches their skills and interests. And some people obviously have greater support needs to be able to do that. one of the reasons that the plan and the recommendations that the task force developed is so important is to make sure that this transition is inclusive of everyone, regardless of their disability. This was a top task force consideration in building the plan, and one that we heard from the community engagement. So several of the recommendations proposed by the task force specifically addresses the support needs of people with significant disabilities, and provide a path to helping them meet their goals. So again, just to reiterate, those recommendations include expanding supported and customized employment, where job developers work with people to tailor jobs to their specific skills and interests, and job coaches help people be successful at their job, as well as strengthening access to transportation services. The task force also recommended targeted engagement and education and support to make sure that they're reaching people who are currently earning subminimum wages during the transition. Again, this isn't about not being in a center, right? This is about the wages being paid. So people are able to receive the services and supports they do now. It's just their wage that needs to change. And it opens up a plethora of opportunities to really support people in unique and creative ways than we never have before. One of the things that I wanted to mention along with that is, well, I'll do this next question first. The next question is, how will people who have one-to-one support needs, but who want to work, be able to participate in customized, individualized employment with the current workforce shortage? Will this change make it harder to find and use supports? So we talked a little bit about this earlier. The direct support workforce shortage is a very separate issue from the subminimum wage issue, right? So one is the wages and the rights of people with disabilities, and the other is the direct workforce shortage. We have a direct workforce shortage right now, regardless of whether or not we pay people subminimum wage or minimum wages. We have a nationwide shortage of direct support professionals affecting all types of support for people with disabilities, including employment supports. But that workforce shortage can't be an excuse for ignoring the civil rights of people with disabilities or neglecting the work that we need to do to advance our support system. So to address the workforce shortage, the task force is recommending increases to reimbursement rates through fully funding the competitive workforce factor and updating inflationary data and waiver and personal care assistance service rates. Additionally, as more people with disabilities participate in their own jobs, like I talked about earlier, this can free up staff previously delivering supports to them so that they're able to serve others and serve people with more significant support needs. We need to rethink our community supports in the context of the workforce shortage and increasing individualized community-based supports. We have to have that third leg of the stool and really figure out how we can have it be not just providers and families that are providing all of the supports, but how community can really be part of the solution that we need in Minnesota long-term. We need to call upon the strengths of our communities across the state to be supportive places that people with disabilities are included, and we need to leverage those informal networks and reduce reliance on formal services paid for by the state. So as part of that, the task force recommends engaging community businesses and developing training and certification to support them to be inclusive work sites. Might not be for everybody. A lot of people will still need all kinds of services and supports, but some people who are currently using them might be able to fade out and use less. And then again, that rebalances that over time. And again, we have that labor market right now where there's a historic demand for workers across the economy. So it's really an opportune time to get people into jobs. When I was doing this presentation at the Down Syndrome Association of Minnesota conference a few weeks ago, we had a question from one of the parents in the audience, and she said, you know, this all sounds good and there's a lot of really good recommendations in place, but it's just hard to picture. It's just hard to picture how this really would happen and how this really would come to fruition. And I said, you know, I want to share a story, and I want to share that with you all today. Which is that I mentioned earlier that my parents were both highly involved in working on the deinstitutionalization movement in Minnesota. And they specifically worked in Ramsey County, and they had 2,500 people who lived in Cambridge State Hospital that were the financial responsibility of Ramsey County that they needed to move into group homes. And my dad was the manager for the disability services section in Ramsey County. And the state settled a lawsuit, and they agreed that they would close Cambridge. And my dad was assigned with starting to move 2,500 people out of the state hospital and into homes in the community. And he started getting calls from parents every day who said, please do not do this. My son and or daughter will not be safe or successful in the community. They can't do it. They can't live outside of the state hospital. They can't live outside of the state institution. Please do not make this change. And my dad said, well, this is, this is now a law, and now we're moving forward, and now we're doing this, and we're going to do it one person at a time, and it's going to take some time. It's going to be a phased transition. And they just started, working with families individually, touring group homes in the community, showing people how it could be possible. And slowly people started moving. And my dad actually started that process in the mid 80s. And when he retired from Ramsey County in May of 1998, they had moved the last person out of Cambridge State Hospital 3 months before his retirement. And he said for the last few years of his career, he started getting calls from those same families who said, okay, thank you. You were right. It was possible. We didn't have any idea how that was going to be the case, but it's so much better. They're so much happier now. They have such more inclusive lives, and we see it. We see how it's possible. So I share that story just to sort of say, like, we get that this is really hard to envision, but we also have seen a lot of success in Minnesota where we know that this is happening now, and we know that it's possible, and we know that we have a really good plan. The task force created a really good plan, and the governor has a really good proposal to actually make this a viable next thing that we do in our state. So I was going to now turn this over to I think to Jillian, to go through a few more questions that we have received from you all through the registration.
Yeah, I have a couple more questions to answer. Hold on. Let me locate my list of questions.
Oh, Jillian, I forgot the one about PCA supports. Let me do that while you're
answer that one while I find my questions.
Okay, perfect. So there's a question about how will people who have physical support needs participate in employment? Can their employment or service provider or personal care attendant, which is also called a PCA, provide supports? And the answer is yes. Many people with physical support needs have jobs, and if a person has the need for a PCA at their job, their PCA can provide those supports at the job. And if they have job coaching or employment related needs, a job coach can provide those supports through a waiver or VR services. That was a short, simple one that I was going to add. Okay, Jillian, back to you.
So I have 3 to answer for y'all before we get to the ones in chat. What about people who are living in their own homes and rely upon subminimum wage to maintain independent living? Will they be forced to move into a supported living setting if they no longer work at subminimum wage? To be completely honest, we have not seen examples where a person is able to live independently, such as paying rent in an apartment, through relying on subminimum wage. According to a recent January 2023 GAO report, the majority of workers in subminimum wage earn less than $3.50 an hour. And typically they're not working more than 6 or 7 hours a week. Being able to live independently is an important goal for many of us, and it's a reason why we do pursue employment. People with disabilities can do the same, and we anticipate that with an end to Section 14C and greater investment in competitive employment supports, more people with disabilities will earn a livable wage and be able to afford to live in afford housing. So we actually don't think that this is going to harm people living independently at all. We think it's going to increase it. The next question I have is, what is the plan to find community employment for individuals previously at organizations such as Rise or Merrick? Again, I want to reiterate, employment and day service providers can still provide supports. including center-based employment supports to people with disabilities without using subminimum wage. Many service providers in Minnesota and across the nation have already successfully transitioned to paying competitive wages and supporting community employment. And service providers that extensively or exclusively provide support using subminimum wage are going to need to plan and adapt to end subminimum wage. That is the most important thing about this plan, is that we are giving those opportunities, that option, that support for service providers. To help providers who want to make this change, the Minnesota Legislature also created a provider reinvention grant program that offers both money and technical assistance to help providers change the way they provide grant supports. In fact, RISE has decided to participate in this grant and is carrying out these changes proactively to end the use of subminimum wage in their programs, even before they are legislatively required to. My other question I have, we received a question yesterday that says, my husband and I do not want the subminimum wage eliminated completely. Our son is not now and may never be capable of full employment, but he benefits from working at his DT&H and earning the wages he can. If his DT&H is forced to pay minimum wages, they will cease to exist, and so will our son's income. We do not want a solely recreational program for our son, and indeed, he would not participate in such a program. Why must the subminimum wage be eliminated altogether? Why can't it exist alongside minimum wages so those who can benefit from it continue? I want to start my answer to this question with a quote from civil rights leader Audre Lorde. She said, "I am not free while any woman is unfree, even if her shackles are very different from my own." As a person with a disability, and I am aware that my employment and my life is very, very different from people in Section 14C scenarios, but I am not free. None of us are free while any of us are being treated differently than people without disabilities. This, at the end of the day, is a civil rights issue. People with disabilities deserve to be treated with the minimum respect and the minimum requirements that we treat people without disabilities. And that is minimum wage. Minimum is the minimum for a reason, and less than minimum should not apply to people with disabilities. Additionally, again, we are not saying that this young man's job has to end in any capacity at all. We are simply saying that in that program, he deserves the civil right of being treated the same as every other person with disability and being paid minimum wage. We are not saying he has to be in a recreational only program, just that minimum wage is minimum wage for all people. We have seen overwhelming success from people who have transitioned from this program and into that. And I also want to challenge this idea that your son is not capable of this. Subminimum wage programs in Section 14C actually limit what people with disabilities are able to do. In order for a job to be able to be paid subminimum wage, it has to go through something called a time study. So only work that can be done in a time study where you can compare the productivity of work of a non-disabled employee to a person with a disability can be part of that program. There are a million things in this world that we cannot measure by time study or in productivity. We can't measure customer service. It's fairly hard to measure organization in it. We can't measure 1,000 other things in time studies. So it limits people with disabilities to the type of work that can be measured minute by minute in productivity. We want to give people with disabilities an opportunity to contribute what they're best with. I mean, I will be honest, I am competitively employed by the Autism Society of Minnesota, but if you put me in a room and told me I had to assemble widgets or put buttons in a bag or assemble plugs, I'm also going to make subminimum wage because that is not a skill or a talent I have with a disability that impacts my fine motor skills. So how many people are we looking at in employment saying, well, they can't perform at the rate a person without a disability can perform at, but we're only giving them tasks that aren't suited for them or jobs that aren't the right fit for them. If we take them out and say, what are you great at? What do you bring into this world? What brings you joy? we find a job that matches that. We open up a wide plethora of employment opportunities that may mean that your son is capable of competitive or customized employment in our community. He may never be assembling widgets at the same rate as a non-disabled person, but there's a whole world beyond widgets. And that's the world we want to open up with in customized employment. My job is customized employment. I was actually hired as our receptionist. Turns out I'm a really bad receptionist because that is not something that meets my skills. But I had an employer that was able to look at me and say, these are the things you're good at. This is the way we can support you in the things that you're good at. And we can find supports for you for the things you're not good at. And I'm thriving. The reality too is that some of the, even within these subminimum wage programs, there are a lot of people that are being turned away from employment. During the legislative hearings on Capitol Hill, we heard from a young man who has a developmental disability and he is blind. He had actually been told by his DTNH that he wasn't employable through their subminimum wage program, that he could not get a job, that he was unemployable. He ended up working with state services for the blind, and he's employed in the community, making well above minimum wage, working with non-disabled coworkers in his community at a local Pizza Hut. There's actually many news stories about him. But he was told by subminimum wage employers that he wasn't employable. And now he is employed in our community in a supported capacity. In fact, he doesn't actually have a job coach with him. He works independently, supported by his colleagues. And that is what we believe is possible. We believe that too many times we have been told your person isn't capable of doing this work, so we're not going to give them try something that's a better fit for them. So it's all about potential, possibility, expanding the view of what we think people with disabilities can do, and basic civil rights. We all deserve our basic civil rights, and no one is free until we are all free. We have a few questions in the chat, Andrea.
I can, so one of the ones that is kind of a theme is about benefits. And I know that Jillian touched on this earlier, but there's a couple different pieces, right? So we in Minnesota are super, super fortunate because we have a program called Medical Assistance for Employed Persons with Disabilities, or MAEPD. And that is a program that allows people to work as many hours a week as they want and make as much money as they want and keep their waiver services, right? So like I have a couple people that I have worked with over the years who are making upwards of $75,000 to $100,000 a year and keep their waivers, like keep their CADI waivers. Because they're able to use medical assistance for employed persons with disabilities. So there shouldn't be a fear or worry from people or their families that people would lose waiver services because of earnings. And then there's also the question about Social Security income, which is dollar for dollar in terms of how much you earn. And so that doesn't go away until you're actually earning. You know, it goes down by $1 every time you earn $1. So it doesn't go away completely until you're earning more. So it's always exactly the same until you earn more. And so it's always better off to work when it comes to Social Security. There are questions about co-payments and asset limits. And Jillian probably could speak to those a little bit better, but there's currently legislation that we're trying to move forward so that people can continue to build that independent wealth and not have to stay to a certain asset limit or spending level.
So, I mean, right now we do have a program called Medical Assistance for Employed People with Disabilities. I'll be completely honest with all of you because I'm an open book. I'm actually on a waiver, the same as a lot of the people that we're talking about that are in Section 14C programs. I have a CADI waiver and I receive my benefits through Medical Assistance for Employed People with Disabilities, which actually allows people to pay a premium based on their income. And it increases your asset limit up to $20,000. And we are working on reforming this to reduce or eliminate the fees that are paid by people with disabilities and to eliminate that asset limit. So we're hoping to see that. Andrea, I also wanted to share a comment that I think kind of falls into some of these services and supports and benefits. Someone named Sheena commented that I know that that there are wait lists for day services, waiver funded employment services, and customized employment. And until more money is given to providers, it will continue to be an issue. I feel like I needed this bill passed last year to support my clients now. We have customized employment, but it's over a 12-month wait list, and I'm struggling to advise my clients and their support on how to move forward. This is actually one of the most critical reasons why eliminating subminimum wage is necessary in making this transition. Currently in Minnesota, we are spending about $200 million a year on Section 14C employment and supports, where we're only investing about $20 million a year in customized and competitive employment supports. We have to shift that financial expenditure. Like, there's a lot of people that are saying, why can't we just do both? Why can't we move people into customized and competitive employment? We'll still allow this to stay. And some of that is a financial reason. As long as we have $200 million tied up in serving approximately 3,900 people, it makes it really challenging for us to move people into that customized and competitive employment and fund those employment services. In order for this to be successful, we have to make that monetary shift to be able to provide people the types of supports and services they need in the community.
And then I had a question that came in about any updates on the legislative conference committees and whether or not it looks like this will pass this session. Actually, at this point, it's a wait game. Like John Alexander talked about earlier, the governor's proposal is in the House of Representatives, Health and Human Services Omnibus. It includes all of the things that we have been talking about to really be able to make sure that we have that viable presentation or transition, right? The governor's budget includes technical assistance, which is funding for providers, grants for lead agencies and counties, because they're going to be such a huge part of this transition, a data collection system so that we're working really hard to make sure that nobody falls through the crack and we're tracking what's happening and that we can readjust and course correct as we need to. A community engagement and communication plan so that people really do understand the kinds of things that we're telling you today, right? Providers can stay open. Businesses are willing to renegotiate contracts. You can earn as much money as you want under medical assistance for employed persons with disabilities and keep your waiver. All those kinds of things are things that we really need to get out because people are worried and they're scared, and they don't need to be if they understood all of this information. The governor's budget also includes interagency program alignment, which is a kind of wonky term, but it really means a lot of work to make sure that the Department of Education, so kids transitioning out of school, work well with voc rehab and with the Disability Services Division and their waiver services. And then there's that support that the governor has in his budget for inclusive workplace training and certification for employers, and then case management training requirements. So all of those things, like we talked about, are included in the House of Representatives Health and Human Services Omnibus, and they were not included in the Senate's Health and Human Services Omnibus. And so what happens then is that they have 6 people who go into conference committee, 6 senators, representatives, and they negotiate the terms of each of those omnibus bills. So there's differences between the House's bill and the Senate's bill. And this is just one of them. There's dozens of differences, right? And they go and they talk about all of the different differences, and they come to an agreement on what would be in a final budget bill that then would go to the House, or that then would go to the legislative floor to vote on. So the representatives and senators are supposed to have their work completed by May 22nd. And I think there's a little bit of an earlier Jillian might know more, a little bit of an earlier deadline so that they can get everything.
That's gone out the window. We're looking at the 22nd again.
22nd. Okay. So it is the
22nd.
So the answer to the question is, is there any updates on the legislative conference committee? Is no, there's not. They're in negotiations right now and they're working on figuring that out. And we should know the status of things by May 22nd of this year.
The conference committee did hold a hearing last week, and there were a couple testifiers in favor of subminimum wage, ending, one against, and countless letters supporting this. So right now we just wait and see what they come up with as they iron it all out behind the scenes. There is definitely a lot of provisions in both the House and the Senate file, though, if we're looking at improving the lives and employment for people with disabilities. That is a shared priority across the table. So,
and then there's been some, we've heard people kind of question, and there was a question that came in, which was, could you talk further about meaningful daytime options for those who are not interested in work? And so this, and to be clear, right? Like, this phase out is just about wages. But we know that there needs to be robust, meaningful day services available for people with disabilities in Minnesota. And there are meaningful day services available for people right now. So in terms of people who are not interested in working, the phase out, if they're not interested in working and they're doing subminimum wage work now, then that it shouldn't affect them. But we have, like I talked about earlier, all of the services and supports and funding for day programs, for those day services, that stays. Nothing about the governor's proposal or what's in the House omnibus changes the funding and services available for people to receive meaningful day services in Minnesota. And so I think one of the things that the task force is recommending is to ensure that there is robust services available, is to say what shifts need to happen there in our state. How are people really doing things that are meaningful and make sense to them? And so that they're not just sitting around doing puzzles or doing pretend widgets for practice or looking at each other.
If that's what you want to do. I think this is a really great point to highlight that the meaningful day program is where we really strengthen person-centered planning in Minnesota. I mean, we are not the people that get to prescribe what is meaningful. What is meaningful to me may not be meaningful to Andrea, may not be meaningful to John Alexander, may not be meaningful to someone sitting in a program. Like, we all get to decide what a meaningful option is for our individual selves. So it's not really something that any one of us can prescribe. We need to strengthen those person-centered planning and those options to create meaningful supports based on an individual basis, not this is what Andrea and Jillian said in a Zoom meeting once.
Well, and I think one of the things is that, like I mentioned, I spent some time working in day programs and day training and habilitation centers, and in fact worked for a provider that was in the process of converting from sub-minimum wage to minimum wage and then community-based meaningful day services. And it really is an individualized process, person-centered planning process, where, people are able to kind of look at, like, what do I like to do? Maybe I want to go volunteer. Maybe I want to hang out in some other capacity in the community. Maybe I like being in the day program and I like connecting with other people there and I like doing activities that they have to offer. So it really is about, again, that person-centered, but all of the services, funding, and supports for that stay there, like I said.
Do we have any other questions? We have an early question that says, for sites that are having sub-minimum wage employees volunteering, are these employees still doing the same work and not getting paid at all? And who is now getting paid to have these jobs done? I'll be honest, I don't know that we can answer that question.
Can you say it one more time?
For sites that are having sub-minimum wage employees volunteering, are these employees still doing the same work and not getting paid at all? And who is now getting paid to have these jobs done, like packaging, pepperoni sticks, Meals on Wheels, etc.? I mean, that's hard to say, not working in the programs ourselves. I mean, it is entirely possible that some programs are doing that. I assume that would be a regulatory issue, to have individuals doing work that's being paid for. And that's part of this idea, is that we can move away from some of those potential predatory practices and make sure that we have people working in more regulated situations where we know they are absolutely getting paid for the work that they are doing, or that someone else is being paid to be done, getting paid for that work to be done.
All right, well, I think what we will do is we will turn it back over to the Olmstead Implementation Office. We really appreciate all of you attending today. I know that Jillian and I are happy to have folks reach out to us directly if you have other questions. Please feel free to do that, and really appreciate all of your time. And we're excited about what's next in the state of Minnesota. So thank you for the Olmstead Implementation Office for hosting us today, and back over to you.